Imagine sitting in a cold dentist's chair with absolutely no anesthesia, while someone prepares to pull out your tooth using nothing but sheer brute force. Now imagine discovering that the elegant, expensive dentures worn by wealthy Victorians may have actually come directly from the mouths of dead soldiers. This isn't some gruesome horror fiction. It was the terrifying, everyday reality of 19th century dentistry, long before the comforts of modern medicine. Today, many of us dread visiting the dentist. But if you lived in the early 1800s, a dental appointment was genuinely a nightmare. There were no numbing injections, no electrical drills, and certainly no antibiotics to save you from a lethal infection after a simple tooth extraction. Welcome to the horrifying hidden history of Victorian dental care, an era trapped between primitive superstitions and the brutal dawn of modern medical science. Let us step inside a typical Victorian dental parlor. You might naturally expect they at least had some decent painkillers to ease the unbearable agony. In reality, your best hope was a stiff drink of alcohol, perhaps some laudanum if you were lucky, or simply biting down hard on a towel, and then the dentist would finally bring out the tools. Enter the notorious dental key, an instrument that looks exactly like a medieval torture device. The dentist would hook the metal claw over your rotting tooth, grip the heavy handle, and violently twist it like turning a key in a lock. This brutal turning motion didn't just pull the tooth out smoothly, it often shattered the tooth entirely, fractured the jawbone, and severely tore the surrounding gums. If the tooth snapped off, leaving the broken roots deeply embedded in your bleeding jaw, they would have to dig them out with crude metal forceps. Patients frequently passed out from the sheer physical trauma. Infection was a constant, deadly threat, making a simple toothache a potential death sentence. Surviving the gruesome extraction was actually only half the battle. If you lost your teeth, you needed replacements. And this is where the story gets truly disturbing. Because long before the brilliant invention of synthetic plastics or modern ceramics, the wealthy desperately wanted real human teeth. But where did they come from? To understand this gruesome trade, we must look at the desperation of the era. The poorest citizens often sold their own healthy teeth for money. Destitute peasants would allow a dentist to rip out their teeth, enduring agonizing pain just to feed their starving families for a few days. These stolen teeth were then cleaned, filed, and embedded into expensive dentures, destined for the mouths of the incredibly wealthy and aristocratic upper class. But the supply of willing donors was never enough to meet the massive demand. Dentists needed a larger, more reliable source of healthy teeth. This macabre shortage was solved in 1815 on the bloody, rain-soaked fields of Belgium following the infamous and devastating Battle of Waterloo. Tens of thousands of young, healthy soldiers lay dead. Under the cover of darkness, local scavengers and surviving troops descended upon the horrific battlefield. Armed with pliers, they moved from corpse to corpse, systematically extracting the front teeth of the fallen men to sell on the black market. Barrels of these extracted teeth were shipped across the Channel to London, where wealthy clients eagerly paid absolute fortunes for what became known as Waterloo Teeth. Historians agree this grim practice happened, though the exact scale is debated. However, the term Waterloo Teeth instantly became a highly sought-after luxury brand. For wealthy Victorians, wearing the teeth of a fallen war hero was considered a bizarre status symbol, far superior to any artificial alternatives available. And artificial alternatives certainly existed. Before the invention of synthetic materials, dentists had to get incredibly creative. But the results were utterly horrifying. If you couldn't afford human teeth, your dentures were painstakingly carved from animal bones, walrus ivory, or the massive tusks of dead hippopotamuses. While these ivory dentures looked decent initially, they were highly porous. They quickly absorbed food, saliva, and bacteria in an era without modern sanitation. Within months, the ivory would turn a repulsive yellow, rot from the inside out, and emit an absolutely foul, stomach-turning stench in the wearer's mouth. So, It is no wonder they preferred the teeth of dead soldiers. But the horrors of Victorian oral care didn't stop at tooth extraction. You might think the wealthy at least had a decent daily brushing routine to protect their expensive, terrifying human tooth dentures from decaying further. They did use toothbrushes, often made of stiff pig bristles, and they applied a wide variety of commercially sold tooth powders to clean their teeth. But these Victorian tooth powders were not the protective, fluoride-rich minty pastes we use today. In fact, they were highly abrasive and deeply destructive. A typical high-end tooth powder recipe contained harsh ingredients like crushed charcoal, chalk, rough salt, and even pulverized brick dust mixed together. Some of the most expensive and popular varieties heavily featured crushed cuttlefish bone, which provided an incredibly gritty and scraping texture for daily brushing. While these harsh powders successfully scrubbed away surface stains, making teeth look temporarily white, they came with a catastrophic, hidden, long-term cost. The intense abrasion literally ground away the protective outer enamel of the teeth, exposing the sensitive dentin and accelerating massive, painful tooth decay. So, the very products wealthy Victorians bought to maintain their dental hygiene were actively destroying their teeth, guaranteeing them another agonizing trip to the dentist. It was a vicious, never-ending cycle of painful decay, brutal extraction, and horrifying human-sourced replacements. A true medical nightmare for everyone involved. But as the 19th century progressed, the horrifying era of brute force dentistry and Waterloo Teeth slowly began to face a desperate medical revolution. The single greatest turning point in the history of dental care arrived, thankfully, with the miraculous discovery and application of chemical anesthesia. In the late 1840s, doctors and dentists finally began experimenting with ether and chloroform, offering the first true escape from surgical agony. For the first time in human history, a patient could sit in a dentist's chair, drift into a deep sleep, and feel absolutely nothing. Alongside anesthesia came the revolutionary understanding of germ theory and antisepsis, finally ending the deadly reign of post-extraction bacterial infections. Dentistry slowly transformed from a brutal, unregulated trade of blacksmiths and scavengers into a highly specialized, respected, and strictly sterilized modern medical profession. Even with these monumental medical advancements, the incredibly dark legacy of Victorian dentistry left a deeply ingrained psychological scar on human society for generations. Today, many people still experience intense anxiety and actively delay visiting the dentist simply because of a lingering, irrational fear of physical pain. But when you compare a modern checkup to what our ancestors endured, a quick numbing injection and a few minutes in a comfortable chair is a luxury. Just over a century ago, sitting in that chair meant facing sheer agony, massive infection, and the very real possibility of a horrific, agonizing death, or worse. It meant wearing the stolen teeth of a fallen soldier, ripped from a muddy battlefield, just to maintain a wealthy, civilized smile. The horrifying history of 19th century dental care is not merely a terrifying story about rotten teeth and primitive, highly brutal medical extraction tools. It is a profound testament to the rapid progress of human science, medical ethics, and our desperate historical struggle to finally eliminate physical suffering. We have moved from a desperate era of scavenging battlefields to a modern world where painless, safe dental surgery is something we completely take for granted. So, the very next time you find yourself dreading an upcoming routine dental appointment, just try to remember the terrifying alternative of the dark Victorian era. And remember that the glossy pages of our standard history books rarely tell you the brutal, agonizing, and highly unsanitary reality of everyday human life. If this gruesome journey changed the way you think about dentistry, make sure to subscribe to Forgotten History Studios for more incredible historical revelations. We are absolutely dedicated to unearthing the strange, the shocking, and the very real hidden truths of our collective past that schools simply refuse to teach. From deadly cosmetics and toxic wallpapers to bizarre royal medical practices, there is always another totally forgotten chapter waiting to be uncovered in our archives. Hit that like button, leave a comment if you would have survived the Victorian dentist, and share this video with someone who truly hates dental checkups. I am your dedicated chief historian, and until our next deep dive into the shadows of the past, stay curious and always appreciate your modern toothbrush.